Hey guys, and welcome back. Well, in the wake of Chadwick Boseman's death from colon cancer at age 43, many people have questioned about the disease, especially about the risk of colon cancer in younger people. Now, although the majority of cases are found in older people, there has been an increase in cases in younger people in recent years. Now, among people over 65, rates of colon cancer, which includes tumors in the rectum or the colon, have actually been declining, probably because of more regular screening. Nonetheless, it is the second leading cause of cancer deaths in the United States for men and women combined, and cases have been rising by about 2% annually in recent years in people under 50. Now, this is according to a recent report by the American Cancer Society. Now, experts aren't sure exactly why. Now, for some patients, obesity, diabetes, smoking, or a family history of cancer may play a role, but not all people who develop colon cancer have these risk factors. Now, the bottom line is we just don't know. This is said by Dr. Mendelzo, co-director of the Center for Young Onset Colon Cancer, now at Memorial Sloan Kettering Cancer Center, which was opened in 2018 to treat younger patients and study the reason for their diagnosis. Now, she and her colleagues are exploring whether diet, medications like antibiotics, and the microbiome, which have all changed significantly for generations born in the 1960s and later, might be contributing to cancer in young people. Now, when is screening recommended? Now, everybody should begin screening for colon cancer at the age of 45. That's what the American Cancer Society and other expert groups recommend. But people with a family history of colon cancer should start getting tested at age 40 or at 10 years younger than the age at which their family member was diagnosed, whichever is sooner. Now, Dr. Mendelzo recommends early screening also for people with a history of IBS, which is inflammatory bowel syndrome, like ulcerative colitis or Crohn's disease, and for people who have previously received radiation in their abdomen or pelvis. Now, screenings can be done with various tests on stool samples or with imaging-based tests like colonoscopies. Now, the risks from these tests are relatively small. The prep for a colonoscopy is drinking this, oh God, but no. But drinking this liquid cleanse that removes everything out the colon the day before, and that can be uncomfortable. Take it from me, I've had about 3. But the advantage of a colonoscopy is that it reveals polyps that might be precancerous. They can be removed during the test. Now, yes, like I said, the prep is the worst thing in a colonoscopy because the exact procedure, you're going to be asleep, don't know what's happening or what. So that's fine. The bad part is just drinking this laxative liquid and running to the bathroom and getting your colon clean. Yeah. But you rather do this than to get cancer. So, hey, I'm not knocking this. Now, it makes a huge difference when you detect cancer early versus late. Now, the 5-year survival rate for young people for early stage disease is 94%. Now, for people with the late stages of the disease, the survival rate can be as low as 20%. Now, the difference is between life and death. Now, Chadwick Boseman learned in 2016 that he had stage 3 colon cancer. Now, according to an Instagram post announcing his death. Now, stage 3 have an approximately 60% to 80% chance of cure, depending on a number of factors, including whether the cancer is responsive to chemotherapy. Now, as most disease, there are racial disparities in the risk of colon cancer. Now, according to the recent American Cancer Society report, rates of colon cancer are higher among black people. From 2012 to 2016, the rate of new cases in non-Hispanic black people was 45.7 per 100,000, about 20% higher than the rate among non-Hispanic white people, and 50% higher than the rate among Asian Americans and Pacific Islanders. Alaska natives had the highest rate at 89% per 100,000. Now, African Americans are 40% more likely to die from colon cancer. Now, it's because of the later stage diagnosis. It's because of systemic racism and all that this population have been dealing with for hundreds of years. Now, that's just like Chadwick. He got diagnosed in his third stage. Yeah, so that was a little late. If you could get, the earlier you get diagnosed, the survival rate increases. Now, to say that is, you need to know the symptoms of someone who needs to see the doctor for possible colon cancer. Now, common symptoms include bloody stool or bleeding from the rectum. Other symptoms can include constipation or diarrhea, a change in bowel habits, dark sticky feces, feeling anemic, abdominal pain or cramps, nausea, vomiting, or unexplained weight loss. Now, if you feel something, you have to say something. Don't put it off because you're busy or because you're a young person or because you have too much on your plate. Now, unfortunately, are younger people less likely to receive a diagnosis early? And unfortunately, that's yes. Now, the average time from symptoms to diagnose for people under 50 is 271 days, compared with 29 days for people 50 and older. Now, both doctors and these young folks are not thinking they have cancer. Part of that is screening, but it's not all screening. Young patients have symptoms sometimes for years. For one thing, they're much less likely to have health insurance than older people, and so they have less money. And they're thinking, I'm 30 years old, what could be wrong with me? It's going to go away. But that's not true. There's a lot of shame somehow also. There's embarrassment factor. Well, there's the embarrassment factor. I'm bleeding from my rectum. Now, nobody likes to have bleeding, especially from their butt. Now, especially young people. They don't like to discuss this or disclose this information. Now, that's understandable, but it's our obligation to change that culture. It's okay to talk about your pain in that area, or your bleeding, or your constipation, or your diarrhea. Now, doctors also need to get better at flagging a younger person's symptoms as possible colon cancer. Now, anytime patients are 75 years old and have rectal bleeding, we say, make sure and get checked out for colon cancer. But when younger people have rectal bleeding, sometimes we'll say, that's hemorrhoids or stress from working too much. That's what the doctors are saying. Those symptoms go on for many, many months or years, and now it's not stage 1 anymore. It's stage 3 and 4. Now, once they receive a diagnosis, doctors say the younger people should not feel ashamed. Increasing awareness and reducing stigma, all of this information could save lives now. Keeping a secret is not the way to go. Yes, guys. So, this tragic situation with Chadwick Boseman, we don't know if he had symptoms. We don't know if it ran in his family tree, his family background. But, if you're having any of the early signs, symptoms, hey, even if you don't have insurance, you're a young person, you can always go to every city, state have a public health department. Make an appointment or just walk in and, get that taken care of, because prevention can save your life. And the earliest it's diagnosed, the better chance of living you have. All right, guys, and I do pray for Chadwick Boseman's family, including his wife, his mother, and they are in my prayers. All right, guys, thank you for watching my video. I hope that you will like, share, and subscribe to my channel. And as always, important, be blessed, y'all.